One patient, one therapist, one focus. How is Achieva Rehab redefining the delivery of therapy services? Mary was just discharged home after a total knee replacement. James has fallen several times and complains of dizziness. Helen struggles with walking due to Parkinson's disease, and John has arthritis in his shoulder. None of them want to deal with the travel, the time, and a crowded therapy gym. The days of thinking that successful rehab can only take place in a gym are over. Achieva Rehab is an outpatient provider of physical therapy, occupational therapy, and speech therapy, but different than standard clinics in one profound way. Our place of service is in the patient's home, the least stressful and most convenient location for clients of any age. With Achieva Rehab, patients are able to perform therapy in a stress-free environment with one-on-one attention, making sessions more focused and intensive. You simply don't get that in a therapy clinic. And our therapists don't need to worry about juggling multiple patients at one time. One patient, one therapist, one focus. Unlike traditional home healthcare, we're not limited by rules that say our patients need to be homebound or a payment system that affects our ability to provide adequate intensity of services. We are also trained to monitor the overall health of our clients, ensuring stabilization of medical-related concerns. But what about the equipment? Most patients requiring PT have never touched a piece of gym equipment in their lives, and yet we've been trained to believe that these machines are essential to recovery. Our clients fulfill their potential by using whatever we can carry into their home, our creativity, and their compliance. Those things are essential, but we promise you, nothing more is necessary. The trend in healthcare is moving away from institutions to care in the patient environment. As a result, Achieva Rehab is well positioned to help clients immediately as we take advantage of research that shows and recommends that therapy early on in the continuum of care maximizes outcomes. One patient, one therapist, one focus. That's a better way. www.achievarehab.com. Phone and fax 1-888-929-7677.
Glad you're all here. I'll just introduce myself really quickly. My name is Joel Digris with Achieva Rehab. What we do is we do basically outpatient intensive physical therapy in your home. Okay, so everything we do is based on really intensive PT, and the only difference is instead of going to a clinic, our place of service is wherever your roof is. Okay. I started the program about 4 or 5 years ago, and what really became important about it is that it's just our therapist and the patient for 60 minutes straight, no distractions, nothing else going on. So it's different, it's more beneficial in a lot of ways because you're not in a group of other people getting therapy, and we're completely focused on your needs and your needs only. So I want to congratulate you all for coming because I think it's very brave of anybody who is struggling with something physically, whether it's falls, the poor balance or dizziness, like we all kind of think we have here going on. It takes a big leap for you to kind of actually do something about it. So we're hoping that this is a good start for you guys to kind of get some resolution and a solution for the problems that you're dealing with. Okay? So what I want to start with is 3 stories that I hope that you can relate to, okay? And we're going to tell the beginning of these patients' stories now, and I'm going to tell the end of their stories later on, after we're finished with the bulk of everything that's going on. These are 3 patients that went through our program, and we're going to piece it together at the end to kind of see what kind of difference can be made by what we did for them. So the first was a gentleman who had a progressive neurological disorder. He loved traveling with his wife, went on multiple trips per year, loved gardening, and as his disorder progressed, he was falling so frequently that we figured out his average falls were 1 per day.
Oh my God.
So he was falling once daily. You can imagine how that would impact his life. He wanted to go to Las Vegas. He and his wife went there multiple times per year. His one goal was to get to Las Vegas, and it was, I think, 6 weeks out from when we started with him, something like that. So that's patient number 1. Number 2 was actually my kindergarten teacher. So as I went through my entire life, I didn't touch base with this woman for years, and she found out that I was doing what we're doing now, and we started with her, and she told me two stories that were very impactful on the beginning end of our time with her. Number one is around Christmas time, she sat surrounded by her family and would get so dizzy that she couldn't even turn her head to have a discussion with her own family in the same room. Okay? She loved going to church. She couldn't tolerate being in church because it was so busy. She couldn't tolerate more than 5 minutes in a vehicle because it caused her to get dizzy. So for 20 years, she was dealing with these things. That's two. So those two stories. The third one was actually my sister-in-law. My sister-in-law, fairly young. She's about a year or two older than me. So 23 she is. You be quiet. So she's a school teacher. She woke up one day severely dizzy. Room was spinning around her. She had no idea what was going on. She wasn't sure if the rest of her day was going to be spent at Geisinger or Hershey, or she was going to have to take a helicopter, if something was going on with her brain. She had no idea what was going on. Okay? Scared to death, had to take 2 days off from school, and then she finally realized she could call me. Okay? So those three stories kind of, hopefully one of those stories you can kind of relate to. Whether it's somebody with poor balance, somebody with a little bit of dizziness, or somebody with that kind of really spinny sensation. That's why I'm here to kind of teach you about that and hopefully lead you to a place that we can fix it for you. Okay? So, first thing I want to do is if you can stand, I want you to test your own balance here with us. Okay, so there's two things that we can do. We're going to go through a series of 4 movements. If you can do them safely. If not, and you're hesitant about it, don't do it. But I'm going to tell you why we did it, so it can kind of give you an idea of how your balance is right now at this time in your life. Okay? So if everybody can stand up, if you're comfortable to do so, if you're afraid to do so, that's fine as well. Okay, so test number 1 is simply standing with your feet together. Okay? And if you're afraid to do it, please don't do it. Please don't do it. We're here to prevent your falls, not cause them. Now, when you do it yourself, you got to do it without holding on. Okay, so this is a test. So your feet should be touching. I can't. If you can't do that safely, then sit down. Okay? If you can't do that safely, then have a seat. I'm not trying to pinpoint anybody out, but I want you to be safe. Okay? So that's first one. Second one is you're going to put your feet together, and then one is going to be about halfway in front of the other. So your feet will touch, and one halfway in front of the other. Okay? If anybody's having trouble with that one or wobbly, then you want to sit down. Okay? Go ahead and sit down. No shame. There's no shame. Go ahead and sit down. Third one is now you're going to advance it to putting one foot directly in front of the other. Wow. Okay. If you can't stand in that way without losing your balance, okay, go ahead and sit back down. Okay. Okay. And then the last one, and again, don't do it if you don't think you can, is standing on one foot. Can anybody stand on one foot? Don't take a chance if you can't do it. Okay? All right, everybody sit down. Sit down, sit down, sit down. All right, so the results of that test, okay, that's a specific test that we do with patients to give us an indication on where their balance is. There's been studies done that say that if you cannot stand with your feet together and one halfway ahead of the other for 10 seconds without losing your balance, your fall risk is elevated, more than it should be. Okay? So anybody who couldn't stand with their feet together and one halfway ahead of the other for 10 seconds, so that's 1 1,000, 2, 3, 4, 10 seconds is a long time. If you can't do that, your fall risk is higher than it should be, even at the ages 60, 70, 80, 90, whatever it might be. Okay? So that's number one. That'll give you an idea. Anything after that, if you could successfully do it, you still may have a fall risk, but it's not as bad as it is if you can't do that first one. Okay? Second test I want you to do is, I'm going to time you guys. I'm going to give you 12 seconds. And I want to see how many times you can stand up in 12 seconds. Okay? Hang on, wait till I'm going to say on your marks, get set, go. Now wait, sit down, sit down, sit down.
They're cheating.
I'm going to say on your marks, get set, go. Now wait. When I say it. I'll time you to 12 seconds. When we hit 12 seconds, you're going to stop and count how many times you were able to get up.
Can we hold on or no?
You can hold on, absolutely. You can hold on wherever you normally would hold on. Yep. You ready?
Yep.
It's not a race. Be safe. On your marks, get set, go. Stop. Okay, stop. Anybody get fewer than 5? Okay. So 5 is the cutoff. In your age ranges, you should be able to do 5 times in 12 seconds. If you couldn't get to 5, your fall risk is drastically elevated. Okay? So those two measures are already telling us a lot about what's going on. That your fall risk is higher than it should be at your age. Okay? So I just wanted to get that through. It gives you a little bit of an idea on where you stand for your age. Okay? So, let's talk a little bit about what might be causing your poor balance. Give me a second. And we're going to get to dizziness. We're going to get to vertigo and spinning sensations. That'll come later. We'll talk about balance first. Okay? So the first line says you may be losing blank in your feet, ankles, knees, and hips. Okay? Anybody have an idea on what that word might be in there? Feeling is a good answer. Okay? Strength is not a bad answer. It's an appropriate answer. It's more the feeling. Okay? So one of the areas that your body relies on to help you stay steady is the feeling, the sensation that you get from the bottom of your feet, your ankles, your knees, your hips, your back. Okay? So anytime I move, my body is sending signals to my brain from those areas. Okay? If those areas are changed in any way, neuropathy, past ankle problems, arthritis, that's going to change how your brain helps your body's balance. Okay? Second one is your blank may not be adequate.
Muscle tone.
Muscle tone's not bad. It's not the one I'm looking for.
Hydration.
Say it again.
Hydration.
Hydration's not bad. This is more of a body part. So it's vision. Okay? People don't understand how important vision is for your balance. Okay? So every time we're walking around, our eyes are helping us determine if it's light, if it's dark, what kind of surface we're on, how far away we are from other objects, other people, that kind of thing. So if your vision is diminished in any way, your balance is going to be affected. Okay? Third one, I'm going to give you the answer. It's your inner ear. So your inner ear is not quite doing its job the way it should. So the job of the inner ear is to detect motion of your head. So when I go like this, my brain knows immediately that my head is exactly in this position. Now, I refer to the brain as the general. Okay? The brain is constantly, every split second, making decisions on what muscles need to work so that I can stay upright and I don't fall. Every move I make, every time I step sideways, bend, whatever it might be. The sensation in my ankles, my knees, my hips, my back, my vision, and the information from my inner ear are helping my brain make that decision. Okay, does that make sense? So what happens is, if any of those areas are not working as well as they should be, the brain is getting information either inaccurately or slowly. When that happens, think about how quickly you have to recover your balance. If somebody pushes me, that has to happen very quickly or I'm going down. So if anybody has fallen, it's likely because something is going on in your body that's affecting one of those areas or the brain itself. And then the whole picture itself is not just responding quickly enough. And that's why people have poor balance, okay? For one of those reasons or the brain itself, okay? Any questions? Good. Can everybody hear me?
So if you have a hearing aid, that doesn't matter.
A hearing aid doesn't matter directly. So the hearing part of the ear and the balance part of the ear are separated in almost all instances of things that we're talking about except the nerve. The nerve that goes to the hearing part and the balance part is the same nerve. So if that nerve is not working correctly, you'll lose hearing and balance. But just because you don't have great hearing, it doesn't mean you have poor balance. Okay? I don't talk this much generally, so sorry about that.
I have a question.
Go ahead.
The first one, you may be losing undecided feeling, but what if you do have feeling, like stinging and burning in your legs and ankles?
So if it's altered, you may not be losing the feeling. You may have altered feeling.
Yeah.
So it's not like it was 10 years ago where you're feeling everything normally. If it's altered, it's also going to affect your balance quite a bit. Okay? Okay, so let's go on to the next section. And this section has to do with choices that you guys might actually be making who are having poor balance that might actually make things worse for you. Okay? The first one is, I call it a cycle of decreased activity. Okay? So, what ends up happening is, when you understand that you've either fallen or you have poor balance, you make choices that, because of the fear of falling again, they naturally reduce your activity level. Well, when you're sitting more often because you might be afraid to get up and move for fear of falling, or you're not getting out of bed as much as you did early in the morning, all you're doing with that is you're letting your muscles weaken. So you get into this cycle. You lose your balance, you fall, you have decreased activity, your muscles weaken, and that means things are harder and you're more likely to fall. People don't kind of understand that. They say, well, if I just sit in my chair, I won't be able to get up. Gravity's not going to win this war today, so I'll sit more. You're not consciously thinking about it, but you're gravitating towards less activity. When you're less active, your muscles are just not keeping in shape, and that's going to negatively affect how your balance is operating. And it just continues and continues and continues. Hello. Number 2 is a drug called meclizine or Antivert. Okay, so anybody who has any kind of dizziness or spinning sensation, the doctor may prescribe meclizine or Antivert. Okay, now, meclizine and Antivert is a drug that I call as needed. Okay, it's not a drug that should be prescribed 3 times a day, 4 times a day, but sometimes it is. Okay, people with meclizine or Antivert, they'll think, okay, great, that's all I need is that easy solution that'll help me get rid of my dizziness, and because my dizziness makes me unsteady, it'll help my balance. It actually doesn't do that at all. It just puts a Band-Aid on a problem. Okay, so it's no different than Tylenol or Advil for discomfort, right? You take Tylenol or Advil when you have pain, it might help you feel a little bit better, but it doesn't do anything for the source of the pain, okay? And that's what meclizine or Antivert is, okay? It might decrease your symptoms of dizziness, but it doesn't do anything to address the reason that you got dizzy in the first place, okay? A lot of people make that mistake. The third one is lift chairs. Now, I'm not completely anti-lift chairs. I wouldn't take every lift chair on earth and throw it into the trash. But it kind of goes back to the cycle of inactivity, where people have trouble getting up and down because they've gotten weak, so they get a lift chair. But all you're doing now is making a machine help you get up from a chair. What do you think that's doing for your muscles?
Nothing.
Right. It's actually make them weaker, right? Because you're relying on something else to be a mover of your body. And that's what muscles are for. So if your muscles aren't doing that job, then they're only getting weaker. And weaker muscles means a higher fall risk. Okay, so that's a mistake people kind of make. They have a place for certain people that absolutely need them. But people that kind of use them as a choice, sometimes it's not the best choice. Okay? The last one is probably the worst. A lot of society there's ageism, if you've never heard that word, okay? But people think just because you've been lucky enough to be 60, 70, 80, 90, that these things are going to happen naturally. And poor balance is a natural part of you getting older. There's nothing natural about somebody falling. There's nothing natural about somebody being afraid to go out with their friends or family or hang out with grandchildren because they might fall, or go to their kids' games or whatever it might be. There's nothing natural about that. The human body has the ability to improve at any age, no matter what you've been told, okay? We can cite studies all we want, but the human body can improve in most areas despite your age, okay? So anybody that tells you to live with the risk of falling, or to live with your dizziness, or just be careful and sit longer because you're getting older, it's not the right answer, okay? That's a big mistake, so I don't want you to fall into that. If you take anything away from the rest of today, take that away, okay? All right, so let's get into the dizzy people. All right, any questions on the balance stuff? How it works, why you might be falling? Okay? So let's talk about dizziness, okay? So if we go back to what we talked about, the brain, the general, the sensation in your legs, your vision, your inner ear. The inner ear is a culprit, okay? Nobody can see this, right? The inner ear is the size of a dime. But anybody who has dizziness, that dime-sized organ is likely the culprit causing your dizziness, okay? When it comes to dizziness, and we'll get to vertigo, we'll get to the spinning sensations after this. When it comes to dizziness, the inner ear is intimately connected with your eye muscles, okay? So not only does it have a job for balance, but whenever I move my head, my eye muscles are getting a signal so that they could stay wherever they want to be if my head's going in a different direction. Now, when I'm moving my head, my left and my right inner ear are sending signals equally. So if I go like this, one's going up, one's going down. One's going faster, one's going slower. If you have a weakness in your inner ear, and that weakness is on one side is functioning normally, but the other side might not be sending signals at the same speed. And the result is your eyes get a little goofy and you get lightheaded, okay? So anybody that experiences lightheaded with like a quick turn, or turning their head back and forth quickly, or bending down like this and up, that's most oftentimes coming from the inner ear, okay? And that can be worked on, okay? The other area that the inner ear is in charge of is what we call vestibular ocular reflex. I won't bore you with anything beyond those crazy terms. But a lot of people will get dizziness or that altered sensation when they're in a vehicle or in a shopping area like Walmart or something like that, or people are walking past them. That has to do with the inner ear and the eyes and just that imbalance that might be coming from a weak inner ear, okay? So that's where dizziness comes from a lot of times. People can have dizziness for different reasons, okay? You could have heart problems, you could have blood pressure problems, you could have sugar problems, you could have different issues that might cause dizziness. But a lot of times it's just that small, organ in your inner ear that's causing it, okay? Now, vertigo. Vertigo is a very specific term. It's the false sense of movement, okay? So what that means is if anybody has had any spinning sensation where it feels like you're either moving really quickly or the world is revolving around you really quickly, the easiest thing to compare it to is when you were a little kid and you grabbed onto a stop sign and you ran around it really quickly and then you stopped and everything just kept whirling and whirling and whirling, okay? That's called vertigo. So we want to make sure that when you use the term vertigo, you're talking about some sort of spinning, because that's all it is. Dizziness, like I described just prior to this, is not vertigo. Vertigo is very, very specific, okay? Anybody here have that sensation? Have you ever experienced that spinning kind of feeling? Okay, handful, good. Normally you feel it. Normally you feel it when you lay down in bed, roll over in bed, get up from bed, bend down really quickly. Most of the time, it's from something called benign positional vertigo. And if you've ever heard the term crystals, that's exactly what that is. Okay, so I'm going to try and explain it in an easy way to understand. The inner ear, if you can picture one round kind of main home base in the inner ear. And then there's 3 loops that are connected to that home base. Those loops are like a hula hoop with fluid inside. Okay? Now, what happens if you have a hula hoop with fluid and you turn it? What happens?
It all belongs to the one side.
Okay. So the fluid moves inside, right? That's exactly what happens in your inner ear. When I go like this, those little loops in my ear now go like that, and the fluid circulates in there. The reason that fluid circulates is because when it moves, it tells your eye muscles what they need to do, and it tells your brain what position your head's in. And that's how that operates, okay? So when I go like this, that fluid moves to tell my eye muscles what they need to do, and my brain exactly what position my head's in. Now, in the main section of the inner ear, which these loops are connected to, there's little crystals that are supposed to be there. They're all stuck to the roof. In positional vertigo, what happens is they kind of fall off like snow, and they make their way out into the hula hoop areas. Okay, so now, you got your hula hoop. It's got the fluid in it, but now it's got little pebbles in it. Okay, those crystals have floated out in there. It's got these little pebbles in it. When you turn it, the fluid moves, but what happens to the pebbles?
They move too.
They move as well, but not at the same speed, because they're a little heavier. So what that means is, when I move my head like this, and the fluid moves, I'm getting the signal that I should get to tell my brain what position my head's in, and my eyes what they need to do, but I'm getting a second signal that should never go with the first. And what happens is you get 2 signals to eye muscles that should not work together. And it causes what's called nystagmus, which is a sensation of your eyeballs bouncing like this. Your eyes actually twist rapidly like this. Okay? So anybody that's had that sensation, when you lay down in bed or roll into a specific position that causes those crystals to float around, your eyes are literally doing this until those crystals stop moving. So normally it only lasts for 30 seconds to a minute, maybe 2 minutes at the most. Afterward, you'll feel nausea, you'll feel sweaty, you'll feel like your heart is ready to pump out of your chest, you're scared. That's just a nervous system reaction to that nystagmus, okay? So anybody that's had that really spinny sensation, it's actually your eye muscle doing this until it stops, okay? That's benign positional vertigo, okay? So what do you do for it, okay? The crystals are not where they're supposed to be. The crystals are causing the eyeballs to spin. So we need to put them back into the main hub of the inner ear. That takes 5 or 10 minutes. And then you're in good shape. Okay? It's my favorite type of condition to treat. It's hell for somebody who's going through it. But if I come in and I say, I can take your hell away in 10 minutes, that's pretty cool.
When does it come back?
It rarely comes back. Okay, I've done it hundreds of times, and I've had maybe 4 or 5 cases where I've had to do it a second time. The secret to it is, once they're back where they belong, and we know how to get them where they belong because of the anatomical position of the inner ear. There's movements that we could tell that when you get to the last movement, they plop right back into where they belong. When they're back there, it generally takes about 24 hours. So you have to be careful with what you do over those 24 hours, but they reattach where they belong in the very, very high majority of cases. And if they reattach the way they're supposed to, and you've followed the instructions, you should be good to go. Okay?
What do you do to make them go back where they're supposed to be?
So, because we know exactly how the inner ear is positioned in your head, we know that if we move it certain ways, when you get to a last position, those crystals have moved to the top of the loop to where they fall back into the main area of the inner ear. So it's something called, in 93% of the cases, it's called an Epley maneuver. There are some cases that are a little bit more challenging because they're in a different canal, different loop. Most cases are in what's called the posterior canal.
How do you know what loop they're in or what canal they're in?
The way your eye muscle moves, your eyes move. So when I do the test, if your eye moves this way and there's a twist to it, okay, if it moves fast in one direction, I know it's coming from one canal. If it moves fast in the opposite direction, I know it's coming from the other. If it only moves side to side, I know it's coming from the third canal. So all I have to do is look at your eyeballs when you're dizzy, and I'll know where it's coming from. That will tell me what to do. We do the 5 or 10 minute maneuver. You follow the instructions, and you're good to go. Okay? High majority of cases that happens. Okay? Any other questions on that? All right. So, if we go back to balance, the hard part with giving advice on balance is what we do is physical therapy, okay? So when we're working with someone who has balance problems, they often look at me like I'm nuts because they come to me and they say, help me with my balance. And I say, okay, great. The way we're gonna help you with your balance is we're gonna make you off balance. Right? How many people think I'm nuttier, even nuttier than you thought when I first got here? What happens is this, okay? The whole system has to learn to do things differently. So you got the general, you have the inner ear problems maybe, you have the visual problems maybe, you have the sensation problems maybe, or you have a little bit of all of those. What we need to do is expose the brain to circumstances where you're a little bit wobbly. And the brain actually has the capability to rewire itself to take that information a little bit differently, and your balance improves. Okay? So everybody that we work with who has balance problems, we will make you lose your balance in a controlled manner. We don't drop anybody. It's a controlled manner. But when you expose your brain to exercises that make you a little bit wobbly, okay? Similar to how wobbly you guys were in the beginning when we did those standing tests. When you repeat that over and over and over again, instead of your brain responding that fast, okay, it learns to respond faster because it learns how to do things differently. Anybody who has any kind of stroke or Parkinson's or MS or anything like that, the brain has to learn how to do things differently because it's changed. And this type of therapy is no different. Okay? So when we get into balance therapy, it's us putting you through controlled circumstances where your brain learns over time that it needs to improve what it does or it's going to get worse. Okay? And it absolutely works. Okay? Any questions so far? So, the only thing I can give you today to help yourself is a few simple exercises. Okay? I can't give you really advanced balance exercises because why? They're designed to make you unsteady. That's how the balance kind of system works. But these exercises will touch a little bit on your brain's ability to kind of recontrol how it's doing things, and it'll work your muscles a little bit, which is extremely important. Okay? So there's 3 exercises, and they're the only 3 exercises that I feel comfortable with people with balance problems doing on their own. All right? First one is, I give this to almost every single patient that I come across. And my assistants will tell you this too. It's just stand up, sit down, stand up, sit down, stand up, sit down. If you do that throughout your day, every couple hours, okay, you're doing a great service for your body. It works every muscle in your legs. It moves in a way where you have to control your balance a little bit, so it's affecting that. It gets your heart rate going a little bit, so it's affecting your endurance, okay? That's my number 1 exercise for almost everybody. Second one is a simple exercise where you're going to hold on to a counter, either one hand or 2 hands, and you're going to do 3-way kicks. Forward would be 1, sideways would be the other, backward would be the 3rd. 3-way kicks. Just do that as many times as you can on each leg, a couple times a day, and it just, you'll be better than you are today. Okay? The last one is just sidestepping. Okay? So if you have a surface like a kitchen counter, you can hold on to lightly, just sidestepping left to right, right to left. Okay? Now, I have the word rookie on your paper there, right next to those exercises, down on the bottom to the right. That's because those are rookie exercises, all right? What we're interested in is taking anybody who's a rookie today and making them an all-pro, okay? But we don't think you can do that on your own because it's just not safe. So, I'm ecstatic that you guys are here, and I hope you take away quite a bit from this. But you have no obligation to me, you have no obligation to my company, but this is for us to introduce you to a way to find a solution for what you're looking for. If you're dizzy, if you have vertigo, if you have balance problems, we specialize in that, okay? So I would think it would be a great idea to consider talking to us further, engaging in some therapy with us, okay? The statistics are kind of crazy. The number 1 predictor of future falls is the first fall. So if you've been lucky enough not to fall yet, You haven't reached that point. But if anybody's fallen already, it's the number one predictor that a second one is just around the corner. Okay? So we got to get that better. In whatever way we can help you, that's what I'm here for. Okay? So it says, what's in it for me? That's what's in it for you guys. Okay? I gave you a lot of information. My throat's going to be dry for a week probably. But I hope you appreciate what I gave you, and I hope you understand that we have a genuine interest in helping you stay safe, stay mobile, stay active, so that you can enjoy going out with friends and family. You don't have to say no, on a day like today where it's miserable and somebody invites you to go to lunch, or your grandchildren, you haven't seen them, you want to just hang out with them and be able to be active with them. That's what we're all about, okay? So, I want to bring things full circle before we'll get into questions. I want to answer every question that you guys have. But let's bring things full circle. We talked about the patient who wanted to go to Vegas, loved gardening, loved to travel with his wife, and was falling 1 time per day. Okay? He went through our program. By the end of the program, he spent 3 weeks driving to Vegas and back, spending time in Vegas, walking around on the Strip. How many falls do you think he had?
None.
0. Okay. We didn't completely obliterate his fall risk. He had a progressive disorder of his brain. Okay. But he went from falling 30 times a month to 0 in 3 weeks. Okay. He was able to enjoy himself with his wife. He was able to get back to gardening. Okay. And he stayed doing the exercises, so he stayed at a level where, he's probably in decent shape. Okay? The second one was my kindergarten teacher, who at Christmas time did not have the ability to turn her head to talk to her family because it made her dizzy. She didn't have the ability at Christmas time to decorate her house for more than 15 minutes before she needed to rest for an hour and a half because it made her dizzy. She couldn't tolerate 5 minutes in a car because it made her dizzy, to the point where she needed 2 hours to recover. She's one of my favorite cases to talk about because she did exactly what we figured out was going to work for her. At the end of her sessions, it was still kind of the end of Christmas time. She cleaned up her house, put stuff away for an hour and 45 minutes straight. Got back to church, took a trip to Ohio from Pennsylvania in a car to see her family. Okay? Third was my sister-in-law, who woke up as a teacher, took 2 days off of school because she was deathly afraid she was spinning. Okay? She had benign positional vertigo. Okay? Thought the world was coming to an end, didn't know if her brain was affected, didn't know if she was going to have a helicopter ride to Geisinger or Hershey, whatever it might be. She was a tougher case. Okay? She had it in that canal that we talked about earlier, the harder one. 2 sessions, completely gone. Okay? So those are examples of what can be done if you're faced with the challenges that we talked about today. Okay? It's not a natural part of aging. There is a fix. There is improvement. Okay? So to get rid of that frustration, just know that there are answers. Okay? I want to open it up to questions. Glad you're all here. I'll just introduce myself really quickly. My name is Joel Digris with Achiever Rehab. What we do is we do basically outpatient intensive physical therapy in your home. Okay? So everything we do is based on really intensive PT